All right, let's dive right into this explainer. Today, we're exploring the reality of obsessive-compulsive disorder, or OCD. It's an incredibly common, widely misunderstood, but highly treatable condition. And right off the bat, I want to make one thing perfectly clear. Struggling with this is absolutely never a personal failing. Today, we are going to look at the real science and the very real solutions behind it.
Here is our roadmap for today. We'll start with an introduction to OCD, look at the symptoms and the cycle, and talk about how it's evaluated and diagnosed. Then, we'll cover the stepwise treatment approach, look into advanced treatment options, and wrap up with some practical tips and hope.
Section 1. Introduction to OCD. Let's break down some of the stigma.
So, there is actually a massive gap between what we see on TV and what patients go through in real life. The media loves to portray OCD as just, being overly neat, quirky, or maybe double-checking a lock. But the clinical reality, it's a deeply distressing condition that can literally disrupt your whole life. Because of this misunderstanding and stigma, it actually takes people an average of 14 to 17 years to finally get an accurate diagnosis. That is a really long time to wait for help.
Section 2. The symptoms and cycle.
To really grasp what's going on, we have to look at the two main drivers, obsessions and compulsions. Obsessions are those totally uninvited, intrusive thoughts, urges, or images that pop into your head and cause major anxiety. Think about an overwhelming fear of contamination, or a really scary thought about accidentally harming someone. Compulsions, on the flip side, are the repetitive actions or mental rituals that a person feels absolutely forced to do just to temporarily relieve that distress.
To put that into perspective, let's look at a few relatable, everyday examples. If the obsession is a nagging fear of leaving the stove on or the door unlocked, the compulsion is repeatedly checking those knobs and locks. If there's a deep disgust with dirt or a fear of germs, someone might get trapped in excessive, ritualized hand washing. Or if there's an overwhelming need for perfect symmetry, the compulsion becomes arranging items on a desk until they feel quote-unquote just right. The behavior is always an exhausting attempt to cancel out the scary thought.
And this right here is the core engine of OCD. It's a relentless cycle. First, an obsession triggers a massive spike in anxiety. To cope, a person performs a compulsion, which does bring a moment of temporary relief. But here's the catch. That relief is a trap. It actually reinforces the brain's false alarm, basically guaranteeing the anxiety will come back even stronger the next time. It just keeps the loop spinning over and over.
Section 3. Evaluating and diagnosing OCD.
A lot of people wonder, hey, is there a brain scan or a blood test for OCD? Well, there isn't. The diagnosis relies entirely on a supportive clinical conversation. A doctor is going to look for a few key features. First, the symptoms have to be time-consuming, meaning they are taking up more than an hour of your day. They also have to cause significant distress or mess with your daily functioning. The clinician will also look at insight. Some folks know their thoughts are totally excessive, while for others, the fear feels 100% real. And again, please remember, it is incredibly common to delay seeking care. You're definitely not alone if you've waited.
Clinicians use structured interviews to ask questions exactly like this. How much time do these thoughts take up, and how much distress do they cause your daily life? They aren't trying to judge the content of your weird or scary thoughts. They just want to measure the actual impact this is having on you. How much time is being stolen? How much distress are you carrying?
Section 4. The stepwise treatment approach. Let's get to the good news.
The absolute best news of this whole explainer is that OCD is highly treatable. A diagnosis comes with the very real medical expectation that you can get better. Doctors use what's called a structured, stepwise approach. Basically, we start with the most common, effective treatments, and if Plan A doesn't hit a home run, Plan B is right there waiting for you.
The gold standard, first-line therapy, is an evidence-based psychotherapy called ERP, or Exposure and Response Prevention. In simple terms, this is a safe, guided way to face your fears. A therapist helps you gradually encounter the thoughts or situations that make you anxious while coaching you to resist the urge to perform your compulsions. It sounds scary, but over time, your brain actually learns it can handle the anxiety all on its own, and the fear naturally fades.
Alongside therapy, doctors often prescribe first-line medications called SSRIs. These simply help regulate the brain chemistry related to anxiety. They work wonderfully for so many people. Just a quick tip, though. Treating OCD often requires higher doses and a slightly longer trial period compared to when these exact same medications are used for depression.
Now, if that first medication doesn't bring complete relief, we move to our second-line options. Your doctor might switch you to a different SSRI or try an older but highly effective medication called clomipram.
They might also use augmentation strategies. That's just a fancy word for adding another medication, like certain antipsychotics, to boost the response. The absolute key here is giving the medications enough time to work and really sticking with your plan.
Section 5. Advanced treatment options. For those with more severe or resistant symptoms, the journey doesn't stop. Third-line and advanced care might involve much more intensive ERP, like intensive outpatient or residential programs. Doctors might also look at glutamate-modulating agents. And then there's neuromodulation, like transcranial magnetic stimulation or TMS, which is a safe, non-invasive brain stimulation. For severe, treatment-resistant cases, there's even deep brain stimulation, or DBS. Medicine has a remarkably deep toolbox for this.
Section 6. Practical tips and hope.
So, what can you and your family do right now? Here are a few practical tips. Seek help early. Please don't wait 14 years to talk to someone. Be as consistent as you can with your therapy and medication routines. Also, try your very best to avoid the reassurance-seeking cycle. Constantly asking your loved ones if things are okay acts just like a compulsion and feeds the loop. Finally, involve your family and support systems in a healthy, structured way.
I want to leave you with this. OCD is manageable and treatable. Improvement is expected with proper care. It's such an empowering message. You really do not have to suffer in silence.
Knowing that a proven roadmap to relief exists, what step will you take today to speak with a mental health professional and begin your journey? If you or someone you love is stuck in that cycle of obsessions and compulsions, I really encourage you to take that first step. Thank you so much for joining me on this explainer today, and keep pushing forward.